Good morning. This is the BLAINESWORLD webcast that can be found each week on Facebook, YouTube, LinkedIn. You can also listen on Spotify, Apple Podcasts, and you can get more information and listen to previous shows at our website, which is kind of behind me, blainesworld.net. I'm your host, Blaine Greenfield, and I'm here in my Zoom studio in lovely downtown Fairview, North Carolina. Each week, we focus on positive news and information about people and organizations, both Western North Carolina and throughout the country. And to that end, it's my pleasure to introduce Dr. Henry Zaremba, lead clinician at Apex Brain Centers. And Henry, you can feel free to wave to all your fans and friends on Facebook or whoever's watching this. I should mention that Dr. Henry Zaremba, I think whether they call you Dr. Z, is that what they call you?
Yeah, Dr. Z.
Dr. Z is a board-certified chiropractic neurologist who specializes in treating brain injuries, learning and behavioral disorders, and neurodegenerative disorders. His personal experiences, concussions as a collegiate ice hockey player, sent him on a path of discovering that turned into a career. He lives in Edneyville, North Carolina, with his wife, daughter, and 2 dogs. And so the first question I always ask Dr. Z when I meet somebody is, as a kid, you grew up where?
I grew up in Raleigh, North Carolina.
And growing up in Raleigh, North Carolina, did you always know you wanted to be this chiropractor, or it's actually a what is the word? Chiropractic neurologist? Did you always know you wanted to be that?
You know, I didn't because I didn't know what a chiropractic neurologist was back then. But I think I always kind of wanted to be a doctor because I saw from like TV shows and things like that, like ER and House and Scrubs. Was one of my favorite shows growing up. So the idea of working in medicine always appealed to me. But it kind of started to take shape during my playing career.
And it's interesting you mentioned that because I used to watch a lot of medicine shows as well, but I don't think I ever saw one involving a chiropractic neurologist.
No,
Has ever
no,
been that? No?
yeah, I'm not sure what that explanation is because I think we need to do a better job with our PR and marketing. That's obviously the issue there.
Or you could be the first one. We'll have a show featuring Dr. Z on, a whole story around you. Well, talk to me then about that. So you were a athlete, a college athlete. You played ice hockey,
Yes, sir. Yeah.
and you got hurt playing ice hockey?
Yeah, so I mean, throughout my playing career, I was always kind of a smaller player. I always kind of tell people I spent most of my playing career trying not to get hit. When I was used to just kind of, getting hit and, maybe I would be a little sore the next day, things like that. But in my senior season, I took a hit that I didn't remember when I got back to the bench. They pulled me out of the game, and I really had a lot more symptoms after that concussion. And so that just kind of opened my eyes in a lot of ways to just kind of the power of the brain, if that makes sense. I was having a lot of insomnia. I was having just some emotional issues, and I had to kind of pull out of my schoolwork for a little bit. Not that I was probably the best student at that point anyways, but when I went through that concussion experience, it kind of helped me understand more about how the brain shapes just our entire reality. I started to have a lot of irritability. I broke up with my girlfriend. I was like not getting along with my roommates. So there's a lot of, the things that you don't really think about that, concussions can affect. I started doing some reading. I found the story about an ice hockey player named Sidney Crosby, who he's still playing, and
Sure.
he's
Yeah.
players in the world. In 2011, he took a hit, was diagnosed with a concussion. They held him out for about a month. And when he got back, he took another hit, and he was diagnosed with a further concussion. And then he missed about a year afterwards. And he ended up working with a chiropractic neurologist. So see, we did make it into the press a little bit.
Well,
And
yeah.
yeah, that
Go
was
ahead.
how
No,
on my
what,
radar.
what's interesting, so even in your career, like when you got that one big hit, I guess, did you know you had a concussion, or was that your first concussion?
It was my most severe concussion I had ever suffered. I likely had suffered one or two minor ones like in my earlier days playing, but I never had as many profound or lingering symptoms like I did after this concussion.
Because I guess one of the problems in the industry or with concussions overall is a lot of people, I guess, never get them diagnosed, or they don't know they have them. They just continue playing, or they get a headache. And talk about that process then. So if somebody's an athlete, they get hit in the head or they get a severe blow or whatever, what should they do at that point in time? Go to a doctor immediately, or what's the procedures somebody should do?
Yeah, sure. So I generally would recommend people go to the primary care provider or go to an urgent care if you hit your head. It's one of those things where there just seems to be a gap in the medical research surrounding what to do with an acute concussion and what's actually in practice today. I still get patients who come into the office with persistent concussion symptoms. And when we're getting the medical history about what happened during the event, they'll say, well, I went to my doctor and my doctor told me just to kind of shut myself in a dark room for a few
Okay.
days. Luckily, I'm not hearing that as often as when I first started my career, because that information is outdated. If that's what you're telling someone to do, in my opinion, that's basically medical malpractice. You're telling them to do something that's going to worsen their condition. The best evidence suggests now that an active recovery is the best way to go about it. But for some reason, that just doesn't seem to be as prominent in a lot of these centers that people go after they hit their head. So 50% of concussions go unreported. So in the first place, if someone hits their head, it's worth it to go get checked out. You want to make sure that you're kind of monitoring the person as well for behavioral changes to physical phenomena like the pupils, changes in their balance and how they're walking or their speech. If it's severe enough, you're going to want to go to the emergency room. But for the most part, I would recommend calling our office if you're in the Asheville area, because there's actually a lot that can be done with acute concussions. But that's what, it being March, it's Brain Injury Awareness Month, and that's what this month is all about, helping bring more awareness to this issue.
We'll talk about that then. So if they call their office, they get hit in the head or they think they have a concussion, what happens after they call your office?
So the first step is going to be an evaluation, so we can actually check, what are we seeing? Are we seeing signs of, you need to go get like a CT or MRI, something that needs to be done at the emergency room, and make sure you're not suffering a concussion and, a brain bleed or something more severe. But if we go through our evaluation, we find, yeah, it's likely you've suffered a concussion. We actually have a lot of tools we can use in the office to help with expediting brain healing. Um, According to the best research, most people will get better from a concussion within about 2 weeks without any intervention, meaning their symptoms will go away. That may not mean they're all the way better, but they'll at least won't have symptoms. But for someone who comes to our office, we're going to use things like cold laser therapy and hyperbaric oxygen therapy, which help to support the neurons in the brain to be more stable. Because when a concussion happens, it's a mechanical force that's applied to the head or the brain, and that leads to the neurons basically being in a stressful environment. So they start to secrete all these different chemicals. So it's really a mechanical injury that leads to a chemical change in the brain. And we can address that with some of the modalities we have here in the office to expedite the recovery and reduce the chance that people have persistent concussion symptoms. That's a tongue twister.
Talk about the process. So even involving you as an example, if somebody gets hit in the head or may have a concussion and they don't get treated, is this something they can get treated a year later or 5 years later? Is that something that should be done?
Yeah, absolutely. I mean, the longer these things go untreated, the brain is always trying to rewire itself and adapt. So the longer it goes without being treated, the more fixed those patterns of brain behavior are going to become. And they can even lead to more serious things down the line. Head impacts and concussions can increase your risk for neurodegenerative disorders, cognitive decline, dementia as you age. So addressing concussions as soon as possible is one of the best ways to make sure that you aren't setting yourself up for negative brain outcomes down the line.
But even after the fact, so it's still to your advantage. Happened 5 years ago or whatever, it still should get checked out if all of a sudden you're having these symptoms.
Yeah, I would absolutely recommend that. And that's one of the things that we're seeing recently too, especially in our post-COVID world that we're all living in. We're seeing that a lot of people are having long haul COVID symptoms or persistent, brain fog and confusion and memory issues after a COVID infection. And when we do their history, a lot of times those people have concussions in the past. So it kind of will leave your brain, even in the absence of symptoms, more likely to respond negatively to things like infections and other issues in the future.
Now, your story is kind of an interesting one in that you mentioned that when you had this concussion, you were going through some things and with your roommate, and then you broke up with a girlfriend.
Yeah.
So it is, I should ask you, I'm prying here, but that girlfriend, is that your wife now or is it somebody else?
No, it's not. She's just somebody else now.
No, but I'm saying, Dr. Z, you think about that, it's a very positive result then of your concussion, it changed
Yeah,
your life,
that's,
had
that's
you
right.
had it not happened, you whatever, who knows? But so talk then about the process. So you were in college as an undergraduate, and what was your major as an undergraduate?
Exercise and sports science. I loved sports growing up. Just, hockey was my favorite, but I always loved, all the rough and tumble sports. I wrestled in high school and I loved football and, especially watching football and hockey and basketball. So I wanted to think, athletic training, physical therapy, something along those lines. But when I started to learn more about Sidney Crosby and what he went through, he worked with a doctor named Ted Carrick, who is credited by most as kind of one of the founders of chiropractic, or functional neurology is another name for it. I started reading more about it, learned I could go to chiropractic school and kind of get my neurology diplomate, which is where you, after you graduate from chiropractic school, you can then achieve different specializations. So there are chiropractic diplomates for things like internal medicine, radiology, orthopedic medicine. So it's kind of like how a doctor or an MD would go to school and then they have another couple years of training before they can call themselves a cardiologist or whatever their specialty is. So I pretty much went to chiropractic school knowing I wanted to further specialize in the neurology treatment. And I was actually able to start taking some of those postdoctorate level classes in school. One of my mentors, Dr. Dishman, who was my professor at Palmer, Florida, also taught for the neurology diplomate classes. So I was able to kind of start taking some of those with him. And I really credit him a lot with kind of helping me in my career in terms of, you know, uh, kind of learning what, this whole chiropractic neurology thing is all about, because it's sort of a new frontier of treatment.
Well, I was going to ask you that to explain it, because again, a lot of people have an understanding of what a chiropractor is or have seen chiropractors. So, and it took me a while to understand the difference. And you did a great job, by the way, explaining that, because a lot of people don't quite realize that there's chiropractors, but then there are other people such as yourself who specialize. And so what does the term then, a chiropractic neurologist do?
So to put it super simply, I'm a neurologist who isn't going to do surgery or prescribe you drugs. But
Cool.
so what we do at our center is we specialize in brain rehabilitation. But what functional neurology is all about is, we do all these different tests for things like pupillary function and movement and muscle reflexes, and they're supposed to tell us about how the brain is functioning. Most medical neurologists are going to do those tests to look for pathology, meaning look for a remarkable change in one direction or the other of some of those tests, so then they can diagnose you with a disease. And a lot of times as functional neurologists, what we do is we kind of narrow the bell curve a little bit to say, even if we're not seeing pathology, we're seeing things moving in that direction, and we can get information about how we can help your brain. The neurons of the brain can be exercised, kind of like muscles. When you play piano every day, you start to learn it, you start to get better at it, and those synapses in your brain are becoming connected. Same thing for teaching someone to walk again after a traumatic brain injury, or teaching someone with dementia how to try to remember things more appropriately. So a lot of what functional neurology is all about is trying to use different exercises to rehabilitate the brain.
But what I'm hearing you say also is that if they work with you or your colleague Michael Trayford at Apex Brain Centers, they're not going to get an adjustment. Is that correct? You don't do adjustments
We
or
do
typical
adjust,
adjustments, but
right?
not, yeah,
So we do, but it's from a different perspective. So, most chiropractors are adjusting people for, headaches and
right.
back pain. So this covers most of the people that are typically in a chiropractic office. We're doing adjustments to try to help with things like balance or even cognition. Brain body connection. If the body is working better, it tends to help the brain work better. So we use adjustments as a tool, but it's just one of the tools in our toolbox. So not every single patient is going to get adjusted, but we do use it to support our other therapies.
Now you mentioned some of the other things you work with, so I understand the concussions, but you mentioned all of a sudden, you were mentioning dementia, for example. You mentioned some other things. Talk about how you work with folks who have dementia.
Sure. So it's all about meeting people where they're at. There's dementia and cognitive decline are generally progressive conditions, meaning they're kind of starting in one place and they're kind of continuing along this process. For some people, it's really fast. For some people, it's kind of slow, and there's a lot of differences there. Our goal is first to try to stop the decline, and a lot of that comes down to the neurochemical changes that happen in the brains of these individuals. There's this buildup of these excessive proteins called tau, amyloid beta, alpha-synuclein. All of these are different things that basically accumulate in the brain in these processes. And there are things that can be done to help drain those proteins and also try to help maximize the health of the cells. So that way we can help to improve outcomes. For example, one of my favorite stories of working with someone with dementia was this woman who came in with her daughter. She was living at an assisted living facility here in Asheville, and she had a history as a social worker was her career. And she started, after her treatment, she started going around and visiting with some of the other residents because she was just feeling so much better that she wanted to be able to kind of socialize with other people and kind of call back to her history as a social worker to kind of just go check in with those other residents that didn't have a lot of visitors. So, dementia is a massive kind of problem in this country. And with most people, it's happening for about 10 or 15 years before you see any symptoms. So that's why I stress for most people, if you hit your head, if you're starting to see different changes to how your brain is functioning, it's important to get it checked out as early as possible, because the earlier intervention tends to be what the research is supporting as the best way to help reduce the burden of those diseases.
Should somebody contact you folks, even if they haven't hit the head? They notice a decline, I guess, in their cognitive abilities. Is that a good time to contact you?
Yeah, absolutely. And we see a lot of people for cognitive decline and dementia. I'm actually going to be doing a talk at the Cliffs community in April to be able to talk to some of the caregivers and the family and the residents there to help spread awareness of there's things that we do every day that we can maximize our brain health with, things like going for walks, what we put in our body in terms of food, even how we're enjoying our leisure time. There's ways that our lifestyle impacts our brain health. And whenever I speak in front of people, I try to have them be able to walk away with something tangible that they can do, when they get home to try to help with their brain.
Well, let me put you on the spot since you mentioned it, the tie-in, which I hadn't realized until you just said it, tie into nutrition. And so explain that tie-in that, um, I should be doing things differently in terms of eating and diet that can help my brain health.
Sure. Yeah, absolutely. And
For example,
sure. So, for example, managing sugar is one of the most important things, whether you're a diabetic or not. So, there's a marker called HbA1c, which is a measure of how well your blood sugar looks over a 90-day period. If you're above certain levels, you're in pre-diabetes range, and then above that, you're in the diabetes range. But even before the pre-diabetes range, if your HbA1c is above a 5.5, you're likely seeing a decrease in your brain volume, meaning that if your blood sugar is too high, it actually shrinks the brain. It's been theorized that about 80% of the cognitive decline that's happening in this country is related to some form of insulin resistance. And insulin is the chemical that helps us absorb glucose into our cells. If you're a diabetic, you don't produce your own insulin and you have to take it as a medication. But that's just an example right there, as a lot of people are drinking soda, having like excessive amounts of candies or ice creams and things like that, when the suggested servings for these things are usually pretty low. So even just monitoring your sugar intake can be one of the best things you can do.
you've taught me something here, and hopefully you've taught some other people something as well. So you mentioned this one way to measure this, but where do you get this measured, or how is it measured? Do doctors don't typically take such measurements or even talk about this? I mean, I don't recall ever discussing this with my doctor, which is a shame in a way. Is this something that should be measured on a regular basis, or should doctors be monitoring this, or patients? How do they keep on top of this?
Yeah, typically an HbA1c is going to be part of a basic blood panel that most practitioners are going to run. It's part of what's called a comprehensive metabolic panel.
Right.
So you likely have had this marker run on you before. It's just a matter of what's the lens that they're viewing it through. Are they viewing it through, do you have diabetes, yes or no? Because that's a way to look at it. Or do we look at it as, is this number in optimal range for your brain to be healthy in a long-term fashion?
So your point is, I think I got it, is that it may be measured as part of that basic panel, but it's never brought to my attention, I guess, unless it's out of range or there's a problem they see. Is that it?
Exactly. And usually once the problem's showing up, it's been happening for a while and then things break down. It's like if the alignment on your car is off, by the time your tire is flat, you likely have some more damage in that wheel well.
Right.
So that's the idea, is looking at everything from kind of a complete sort of profile.
If folks want to measure their brain health or know if they're doing okay, what should they be doing?
Well, there's a lot of ways to go about that. There's a lot of different forms of things like cognitive tests out there, and those are pretty standard. A lot of neurology offices are offering those. But we do a few different tests that are a little more outside the box, but we think still have a lot of relevance in terms of understanding the brain. We do a lot of look at eye movements. We have a machine called a video oculography, or a VOG, which is a diagnostic test where we test how well the eyes can track targets and jump between targets. And the eyes and our cognition, the eyes and our ability to think, are very much linked in the brain. If you think about it, we're very visual creatures, those of us with sight, and our ability to process information visually, think like reading, is a big milestone for our brain development as children, because from there things start to explode in terms of our communication, and even our like kind of abstract thinking abilities. So we do a lot of testing for eye movement, tests for balance. And we also do QEEG testing in the office too, where we're measuring electrical output over different parts of the brain. A lot of times people come to us with CTs or MRIs, especially with concussion. And a CT and an MRI, unless you have a tumor or a brain bleed, likely isn't going to show anything, but it doesn't mean that the brain is working properly. It's kind of like if I showed you the picture of the motherboard of a computer, it's like it may be working, it may not be working. I don't know. It may have a virus or something I can't see. So oftentimes that's how we look at the brain. So instead of just taking pictures of it, like what a CT or MRI does, we want to measure brain function. And the QEEG allows us to do that. Are certain parts of the brain overactive or underactive? And that can help us understand what to do from a clinical perspective in terms of treatment.
Now, I don't mean to put you on the spot here, so we won't talk about politics, but what about, we've all read a lot too much lately about the cognitive awareness test or cognitive test. What is that all about? We read about it, and I think if you can clarify for people that it's a test for cognitive ability, but it's not an intelligence test. Is that correct?
Exactly right. So I'm not really well versed in how a lot of those intelligence tests work, because it's not
Right.
what clinically. But the cognitive tests that we're talking about usually look at things like memory, attentional skills, reasoning, cognitive flexibility, meaning can you kind of jump between different streams of thought effectively. And so it's trying to break down what we do with our brain on a day-to-day basis and like really isolate certain skills, so then we can understand what your strengths are and your weak points are. And a lot of it is based on database comparisons too. We do a lot of database comparisons with demographic matched data. And that can be used oftentimes to aid in diagnosis, because this, we would expect a different score for people of different ages and different backgrounds. So that kind of that comparison really goes a long way in terms of understanding what the findings mean.
One of the questions they asked me, and they asked a friend of mine recently, is to draw a clock, and to, I guess, as part of the standard test and show at certain times. But the reality, Dr. Z, is that a lot of people are going to have trouble in that in the future because nobody uses, clocks. They have, digital watches, so I could get through it, but other people, I guess, are problematic for it, if they've never identified, a real clock, so.
Right, yeah. They're just gonna have like a digital clock drawing or something on there, and they're like, I don't know if this is right or wrong.
Exactly. Well, they tell you draw a clock. With the other one, I got annoyed. I'll just tell you a quick story as an aside that I was asked part of it. I was asked to name 5 vegetables or something like that. I don't know if that's part of the standard test. And so, or 5 fruits, whatever it was. And he named coconut. And the guy said, no, that's not a fruit, it's a vegetable, And then the point of the story, he didn't give me credit for it. I was annoyed. And so I went home and then found out that it counted as both or something. I sent him the information, but he never changed my score. I was disappointed. I said, Doc, here it is. But he was so adamant about it. He said, no, it doesn't count as whatever I said it was. But but it's funny about it. It ties into another thing you mentioned earlier. I guess this whole month in March is what month? Why is it a significant month in terms of brain health?
So March is Brain Injury Awareness Month, and if someone is, so a lot of times there's an issue with people being aware of people with brain injuries because it isn't always visibly evident. So they call it the invisible injury. And it doesn't mean that person isn't suffering. You just can't see it. Like if it was a broken arm and they had a sling on, I can guess, something's wrong with that person's arm. But just meeting someone for the first time, you're not always likely to know that this person was hit by a car a year ago, and they're having trouble remembering faces. So if they're kind of staring at you or something like that, it's because they're trying to remember what your face looks like. Or, someone who has, paralysis in part of the body, they may be intellectually all there, but it's just a matter of they were in a car accident and they, had some damage to the part of the brain that controls their legs. So the idea of Brain Injury Awareness Month is about reducing stigma for people with brain injuries, because just because you have a brain injury doesn't mean you're dumb. It doesn't mean you're not valuable as a person. And so that's one of the kind of the campaigns this year that I've seen on social media is bigger than my brain injury. And I've seen a lot of my patients posting kind of a picture of them with their family, and things like that. So the idea of people with brain injuries as less than is something that we have to get past and understand that we have to accommodate these people because it's more common than you might think. And the other idea too is like we were talking about with concussions, people need to learn to take care of their brains. We're facing a massive public health crisis in this country with the number of people that are diagnosed with dementia each day, and that number keeps increasing. So the more people can take care of their brains when they're 40 and 50, then when they're 60 and 70, they're likely to have a healthier brain than if they wait until they're starting to have symptoms to try to do something about it.
Even in terms of talking about taking care of your brain, playing sports, and you were a jock, at one point in time, you still may be. But what is it that men's soccer now, they required to wear helmets, but women, they still don't, or vice versa? Right? Not all soccer players wear helmets these days.
I hadn't heard that about soccer wearing helmets, but I can tell you that girls' soccer is
Right.
generally the number two in terms of frequency of concussions, right behind football, and then ice hockey is kind of 2B behind girls soccer. So I would guess it would be the other way around. I would think they would
Yeah.
want to put helmets on the girls.
But again, the point, what you just mentioned is kind of scary that they don't require, you would think that playing soccer, boys or girls, you should be wearing a helmet, I would think. Right.
Yeah,
And a
yeah,
lot of people don't have helmets,
sure,
when they play soccer. You know,
sure.
Same thing too. I mean, bike riding changed, now you have to wear a helmet for the most part, but it's incredible. A lot of people still don't wear helmets, when they ride the bikes, Is it, it's not illegal or anything, right? You don't have to wear a helmet when you,
I don't think so, or a lot of the people on the road I drive on would get arrested. So
yeah, well, it's a shame they don't. And talk to me with Dr. Z about one other exciting thing you folks are involved in, that later in this month, you have a big event coming up. What's that event, if you would, please?
yeah, no, thanks for mentioning it. So March 21st, we're at Apex Brain Centers. We're going to be hosting the inaugural Western North Carolina Brain Injury Forum. So this is the first event, and it's hoping to be an annual series. But we're going to have different speakers. So myself and Dr. Trayford, Dr. Michael Trayford, our clinic owner, are going to be doing some presentations on some of the things we do here. We're also going to have a local physical therapist, Dr. Sean Simmons from Movement
Oh,
for Life
sure.
here in Nashville. And we're also going to have Blair Hamill and Luke Short from Matone Counseling to talk about the mental health aspect of people suffering from brain injuries. And I'm also excited to announce we're going to have a patient there who suffered a TBI and his family, and they're going to be the guests of honor too. So our goal is to just bring in people from the community and other healthcare providers to help bring more awareness to the issue of brain injuries as a public health issue, and also more awareness around brain health in general. So we're going to talk about some of the latest science, the latest diagnostic tools and treatments, and hopefully people can walk away with that armed with information that they can use to help their loved ones if they have kids that play sports, or a friend who, fell a few years ago and needs some help. So that's the goal, is just to really give people a lot of education so then they can use that to help themselves and the people around them.
Who's this geared for? Who should be attending it?
If anyone who has kids that play sports, but I'm also our goal is also to have a lot of local healthcare practitioners there, whether they're in physical therapy, dentists, eye doctors, people uh, who go into doctors' offices every day, are falling and hitting their heads, or playing sports and hitting their heads, or having, cognitive decline and dementia type symptoms. So the more that as a medical community we're aware of what some of these signs and symptoms of brain disorder and brain injury are, the better we can get these people hooked up with appropriate services and treatment to give them the best outcomes.
Folks want to find out about this event. What's the best bet?
They can go to our Facebook page at Apex Brain Centers. We have an event page for that. We also have tickets available on Eventbrite. So if you're interested in going, you'll not be admitted if you don't have a ticket. The tickets are free. We just need to make sure we have an accurate head count so we can accommodate people appropriately in our space.
And same question, if folks want to find out more about either you or work that's done at Apex Brain Centers, best way to find out more is what?
ApexBrainCenters.com is our website, and we're also very active on Instagram and Facebook. We post things like patient stories, we post general tips for brain health, and we'll post about some of the things that we talked about here on this podcast. So follow along on Instagram is a great way to get some good information, and there's also more information on our blog on our website too.
Okay, and they go to any of those sites, they can find out more information about you or get in touch with you through those sites.
Yep, absolutely. If anyone's interested in working with us, we do 15-minute consultations that are complimentary to make sure we're a good fit for you and you're a good fit for our office. So if anyone's interested, reach out to the front desk, and we can get you scheduled for a consultation.
Okay, Dr. Z, I'd like to thank you for being my guest on this edition of the Blaine's World webcast. I also like to thank my producer, Cappy Tassetti. Hopefully we'll bump into each other sometime sooner rather than later. Thanks.
Perfect. Thank you so much.